Hello again and welcome to our webinar today. My name is Mengshi Kang. I am the Envision CHW Outreach and Training Coordinator. I will be the lead facilitator for today's webinar. The Envision team is excited for today and grateful for the opportunity to once again be in community with you all, share this space, and have the opportunity to be working alongside each and every one of you. So our webinar today is centered on your chronic disease training offerings for CHWs and access to the trainings. You will also learn how these opportunities can potentially sustain CHW work and contribute to the CHW sustainability paths. Next slide, please. So sustaining the workforce is a priority in the CHW movement. Our previous webinar in December focused on Medicare and Medicaid as potential financial strategies to sustain the workforce. As mentioned in the previous slide, today we are exploring chronic health training offerings for CHWs and understanding how CDC chronic NOFOs or notice of funding opportunities can be linked to sustaining CHW programs. Really exploring and taking what we learned from COVID response and linking that to other CHW work such as chronic conditions. Our hopes are to provide various approaches to assist you all on your path to CHW sustainability. With that, it is my pleasure to transition into our primary content for today's meeting. We will be hearing from Judith Lee Smith, who is the Senior Behavioral Scientist Lead from Behavioral and Applied Research Team Epidemiology and Applied Research Branch of the Division of Cancer Prevention and Control from the CDC. So I will pass it on to Judith.
So thank you so much for that kind introduction. I'm happy to be here to present some of our work on amigas and face your health. These cervical cancer screening interventions are designed with and for community health workers. I'm going to turn my camera off. I'm getting an instability message. I don't know if it's associated with some of the challenges right now. Okay. These cervical cancer screening interventions are designed with and for community health workers and the women they serve. And I think this audience may appreciate learning more about these programs. Next slide, please. So first, I'm going to discuss amigas. Next slide, please. So we are unable to do this work without the collaboration and partnership of a large multidisciplinary team. CDC researchers and researchers from universities, medical centers, and other research centers partnered with community health workers, community health worker administrators in urban, border, and rural locations to form a coalition to support this work. We worked for years to conduct formative research in English and Spanish and develop new materials for the promotoras and the women they serve, as well as for the CHW administrators. Next slide, please. Why were we compelled to do this? We wanted to do this because cervical cancer is a preventable disease. Yet Hispanic women were getting screened in lower numbers and were getting diagnosed with cervical cancer at higher rates than non-Hispanic white women. At the time we began this work, the HPV vaccine had not yet been approved, but we still saw that year after year, Hispanic women were being diagnosed with this disease at high rates. The introduction of the HPV vaccine and the HPV test make this disease uniquely positioned for elimination. In 2023, WHO sponsored a cervical cancer elimination day of action. Cervical cancer elimination is an important goal because it is the fourth most common cancer in women globally. Next slide, please. So you'll see on your screen the Amigas logo and the acronym for Amigas, which is in Spanish, and then in the English language translation for that acronym. And it is a theoretically and evidence-based intervention that was co-created and funded by CDC to promote cervical cancer screening among Hispanic women. Initially, our work was with women of Mexican origin. The intervention is intended for delivery by trained promotoras or community health workers, and it was designed for use in lower income communities and communities that have traditionally had limited access to health care. We work with community health workers and community health worker administrators to develop the materials for the end users. They're women in the community. Next slide, please. So several years ago, CDC developed a framework to characterize the process of taking research from knowledge to action. This framework, called K2A, posits the various steps in research translation. The development of Amigas represented the knowledge into products phase, and that is highlighted by the green arrow. We engaged in a multi-step process to develop or adapt products. Next slide, please. So how did we develop these products? It was essential that we work in and with communities and find out the barriers and facilitators directly from the women who reported they had not been screened for cervical cancer or had not been screened in a while and were not up to date. We also wanted to work with community health workers and community health worker administrators to learn about the barriers and facilitators they were hearing from the clients they served. We conducted focus groups and surveys in English and Spanish, and several important themes emerged. Women reported that facilitators to screening included taking care of the family, also meant that they needed to take care of themselves. A supportive partner or medical provider helped to facilitate or uptake of cervical cancer screening, and also a positive attitude toward the test itself helped to facilitate screening. But there were a lot of barriers: a lack of knowledge or embarrassment about the test, fear about getting the test or the results, some beliefs or attitudes about the test or cancer. Of course, not having health insurance or an unsupportive partner also posed barriers for some women, as well as lack of transportation or reliable transportation, and the lack of childcare or awareness about available services. Next slide, please. But using this information, we also completed another round of formative research and focused on the characteristics of screening. We wanted to know what were some of the positive things associated with screening, and what are some of the negative things. And so you can see on your screen some of the key findings we found from the women were that, well, screening would mean I'm caring for myself or potentially saving my own life. It was important to feel that they were healthy or gain a peace of mind. And also that finding cancer early might be a better option than waiting until things became more serious. You'll also see some findings where I've indicated if these were from the respondents who were born in Mexico or born in the US. Some of the negative thoughts or myths associated with screening was that the test wasn't important, or they might die faster if you knew you had cancer. And then some of the location-based information, for instance, like lack of trust in doctors or test results, or lack of time for self, were also concerns. Next slide, please. Well, after we completed all of our work, we identified that a multifaceted intervention program was needed to encourage women to get screened for cervical cancer. We wanted to increase knowledge, encourage positive attitudes, acknowledge any feelings related to screening. We wanted to also include social reference, such as daughters or husbands or partners, to encourage women to receive screening. We also wanted to reduce system barriers and improve or encourage greater flexibility in clinic hours or availability of bilingual staff. We also wanted to make sure that the program informed women about low cost or free programs to access care. And we believed it needed to be delivered by trusted persons known in and knowledgeable about the community. In fact, community health workers. Next slide, please. So Amigas has many components. You can see a lot of those on the screen. We used information from the community guide to include small media, and we also improved a lot of the materials in our work with the community health workers. The Promotora guide, the body diagrams, a contact sheet, message cards, which help to acknowledge and discuss feelings and beliefs that women had in a respectful way, a resource sheet that helped to share information about local services, including where to go and what services might be available, and then a promise sheet, a contact sheet, and appointment cards, all developed to reinforce positive behaviors, making a promise to yourself to get screened, and also providing contact information and your current thoughts and plans for getting screened. This tool was important, or all of these tools really were important, to allow for tailored follow-up and review by community health workers to support the women that they served. Next slide, please. After we developed all of these materials, we wanted to do a study to see how well did they work. We thought that the data, our theories, everything was suggesting something would be quite successful, but we needed to test it. So we did a randomized controlled trial with 613 women, 21 to 65 years of age, no previous cervical cancer, no hysterectomy, and no pap tests used within the last 3 years. And we wanted to examine what would be the receipt of pap testing at 6 months after the intervention. We conducted this trial in an urban border and rural location, Houston, Texas, El Paso, Texas, and Yakima, Washington. And we spent a lot of time recruiting women from a variety of venues in those locations, including beauty salons, jewelry stores, bakeries, schools, community centers, churches, and laundromats. Next slide, please. So on your screen, you can see that both the full intervention and the two small media components, the movie and the flip chart, were quite successful at improving screening at 6 months compared to a control group, which is in red. And importantly, we verified the receipt of screening by using medical records. Next slide, please. So all of our materials are available on the CDC website. Next slide, please. And these are just some of the intervention promotion materials that we have. All right, next slide, please. So following this success, we considered adapting Amigas for a different population, and we identified African American women as a population of interest for several reasons. Next slide, please. So at the very least, we might not have needed a miracle, but we did need to articulate what needed to happen. Given a certain input, what must occur to get a desired output or outcome. We wanted to make sure that we employed as we had for the Amigas intervention, several behavioral methods and theories to develop a way to address the concerns about cervical cancer screening. And also, we wanted to conduct our formative research to make sure that we were informed with what had already been published in the literature. And we also knew we had to partner with the community and with community health workers to ensure we develop the best materials. Next slide, please. So I want to acknowledge the large team that I led for this initiative. The community health worker group was comprised of community level experts who were essential to this adaptation of Amigas into the Face Your Health intervention, and they provided important perspectives informed by years of work in and with the community of interest. We also had a really competent team of contractors who were experienced in health communication and public health. And the CDC team provided expertise in behavioral science, epidemiology, health communication, and community-based participatory research. Next slide, please. So all of our work resulted in an adaptation of the original Amigas. So it's another educational outreach program for community health workers to help promote cervical cancer screening among African American women 21 to 65 years of age who have never been screened for cervical cancer or who were not getting screened regularly. And this was an important population because African American women have the second highest cervical cancer incidence and the highest cervical cancer mortality. And at least one study has estimated that with using hysterectomy corrected rates, that cervical cancer mortality for African American women is similar to women in sub-Saharan Africa. We conducted a literature review and identified lots of barriers. We also recruited and identified and established a national work group of community health workers and community health worker administrators who were essential to developing new materials and vetting the intervention components to ensure the materials were responsive to the needs and experiences of their patient and client populations. We also revised all the materials for a new population and updated and revised messages, developed new graphics, and created additional materials to meet the needs of African American women. And then we also conducted focus groups with women and community health workers who served them. And we examined and explored all aspects of the materials, messages, and graphics. Next slide, please. Why did we want to adapt Amigas and why did we think it was potentially something that could be successful? African American women and Hispanic women share similar facilitators and barriers to cervical cancer screening. Community health workers are an effective mode of information transmission in African American communities. And we wanted to make sure that we could leverage the expertise and the resources from the community health workers for the initial development and to also position the intervention for wider dissemination and translation. Next slide, please. So there were a lot of challenges and questions that we addressed. You can see those on the screen, but we're hoping that these materials in their evolution will continue to address some of these challenges and questions. Next slide, please. These are just some of the materials. Next slide, please. And some of the promotional materials that we have for this intervention. Next slide, please. So translation is an evolving and continuous process. Many models demonstrate the interrelated nature of these types of efforts. For Amigas and Face Your Health, we have opportunities to learn from community health workers and community health worker administrators and the clients they serve, and to ensure that we can promote dissemination above and beyond scientific publication. Next slide, please. Now this might be the hardest work yet, the dissemination of the intervention and the implementation of the intervention with fidelity. It is very time-consuming and critical work, but we want to see the intervention in practice and to learn from the field how we can modify, improve, or create additional tools to support screening and uptake among women who are not up to date. Next slide, please. It's worth doing. And we're working to improve our research and the application of our research on behalf of and for the benefit of the American people. Next slide. I know we'll have questions later. And finally, thank you for your time and attention. My email is on this slide should you have any questions or desire to follow up. Thank you.
Thank you so much, Judith. I do want to let everyone know that Judith unfortunately has to leave for another meeting, so she will not be joining us for the Q&A section, but I did drop her email down below. So if you have any questions and want to learn more about Face Your Health and the Amigas program, please feel free to email her. So with that, I would like to move on to our third and final presentation from one of our CCR 2109 recipients. And we have representing them is Morgan Curhan, who is the state community health worker coordinator. She's also been a really great ally in the state of Wisconsin and nationally as well too. So she's coming from the chronic disease prevention unit of the Division of Public Health from the Wisconsin Department of Health Services. So I'll pass it on to you, Morgan.
Great, thanks, Mengshi. Hi, everybody. Happy Thursday. Thank you, Mengshi, for that great introduction, and appreciate Envision including Wisconsin in this monthly webinar. It's been really great content thus far, so hopefully to close us out well. As Mengshi said, my name is Morgan Curhan. I'm the Community Health Worker Coordinator within our Chronic Disease Prevention Program at Wisconsin Department of Health Services, and I'm also a proud Community Health Worker ally. And just before diving into the content, I also want to give a shout out to my Wisconsin colleagues who are on the call today, including a couple, I think I saw community health workers who we work with through the 2109 CCR funding. So just thank you all for being here. Awesome. So I guess I'll probably zoom out a little bit and not focus so much on specific program content, but thinking about how community health worker work really is integrated across multiple areas within our chronic disease prevention program. And hopefully this brief conversation generates some ideas for you all for future collaborations and expansion of the community health worker work beyond 2109 CCR funding, but really thinking about how this work could cross-cut other programs within your departments or programs or organizations. So for Wisconsin, our chronic disease prevention program at DHS is made up of 5 key areas that really include cardiovascular disease prevention and management, diabetes prevention and management, of course, community health worker initiatives, physical activity and nutrition, as well as Coverdell stroke prevention program. And I listed those 5 buckets and some of the affiliated CDC numbering coding that CDC uses for those grants. So look out for those if you all have some of those fundings also in your departments or programs. And in addition to those 5 kind of key content areas that are situated within our program, we also have a lot of focus and emphasis and some other funding opportunities that are really focused on health equity as an overarching component of all of these topic areas, and some additional funding resources specifically for community-based health equity and social determinant of health initiatives. So really within each of these funding cooperative agreements or funding opportunities from the CDC, There are actually some specific strategies that highlight and or integrate community health workers as a workforce integration, which some of you might already be familiar with, but I just wanted to highlight some of those specific strategies where we can think about how CHWs are integrated into this work. So just a couple that are really specific to some of these different funding initiatives are, of course, social determinant of health screening and referrals to community programs for social supports. CHWs are great at doing some of that care coordination and identifying social needs. Also thinking about team-based care or multidisciplinary care teams and partnerships with community and clinical linkages. Additionally, thinking about how community health workers are part of that continuum of care, especially when we're working with community-based clinics. And I'm getting a little notice that my internet is unstable. So hopefully, am I coming back now? I don't know. Is it better? Okay, thank you. So, yep, how community health workers are part of that continuum of care. And specifically, maybe how community health workers are accessing and have access to electronic health records and databases that really support documentation for the clients that you're working with. And of course, I think I'd be remiss to say that all of these topic areas have specific highlights of improving the sustainability of community health workers by strengthening that overall infrastructure of the workforce. Next slide, please. Great. So today I want to highlight maybe more specifically how within the chronic disease prevention program, community health worker initiatives are really a cross-cutting theme across the various notice of funding opportunities from CDC and how they show up in a couple different ways beyond the 2109 CCR. So I guess just looking back a little bit, in the past, over the last several years, there have been CDC funding initiatives that support community health worker work, albeit perhaps not explicitly as 2109 CCR, but there has been an emphasis on increasing CHW financial sustainability and maybe thinking about that community clinical linkage. But the work was maybe more siloed into one specific program area, like CHWs working in cardiovascular disease or CHWs working for diabetes prevention programming. And what we know and what I want to highlight is when we think about financial sustainability for community health worker workforces, it's not the only piece, the important piece of the sustainability of the workforce, right? We need to think about sustainability as a whole. And if we're going to lift up all of those pieces that make up CHW workforce sustainability, then we have to do so across all programs, across all health topics, and really incorporate these activities in all funding initiatives that include CHW work. So really, this infrastructure of CHW sustainability work is happening across the board in whatever health topic might be situated within your programs or departments. So on the screen here, on the left part of the screen are really the areas within our chronic disease prevention program that I highlighted that we cover within our program. Which is cardiovascular disease, diabetes, community health workers, physical activity and nutrition, and stroke prevention. And in the middle of the screen are many of the cross-cutting community health worker workforce themes that really expand and transfer across any of these health topics. So I think, definitely thanks to the 2109 CCR funding, it has really given Wisconsin and our chronic disease prevention program an opportunity to really expand our team's capacity to focus on these key themes or key components that are needed for sustainable CHW workforce infrastructure. So some of those things that really we've been able to uplift, not only within 2109, but really infuse into these other program areas and cooperative agreement fundings, are expanding community health worker core competency training. So I think this was mentioned throughout some of the other speakers' presentations, but really uplifting and dedicating time and funding to support CHWs participating in a core competency training that really is aligned with those C3 core competencies and core consensus project that Betsy was sharing earlier. Also, another thing that has really been a cross-cutting theme beyond 2109, but within the other NOFOs, is how to support community health worker peer-to-peer networking. So whether that's pulling together or strengthening regional networks, CHW peer learning groups, things like that. And another piece kind of along the same lines is a space for community health worker supervisory support. So we know that CHW supervision is incredibly important as a successful tool for CHWs to feel included and welcomed and supported within their employment opportunity. And sometimes CHW supervisors need their own training and support for themselves, right? That comes with a whole new territory of supervision. So really uplifting that no matter the project or content area the CHW is working in. I'll also highlight that it's been really important for us to uplift community health worker leadership development. So thinking about ways that CHWs have leadership training or professional development that really builds that confidence, builds ownership of the work, and that can lead to strengthened regional networks, associations, and more collaborations within perhaps a workforce coalition where CHWs are working alongside allies for those bigger decision-making processes around sustainability. And then lastly, a really important piece to highlight throughout any of the funding initiatives is really exploring how finances or grant funding opportunities or cooperative agreements can be braided and blended funding, right? So as I mentioned just in the last slide, that it's really important to de-silo how community health workers are working on different initiatives. You know, how can we, through funding, also support that whole person care by braiding together different grants that might support behavioral health and chronic disease and substance use and housing, or any of the above, to really ensure that the CHW is able to work across their entire scope of practice and serve the clients in a whole person care approach. And then the three boxes on the right side of the screen are all kind of groups that have really developed during the course of the 2109 CCR. But we're really hoping in our chronic disease prevention program kind of outlive 2109 CCR and really are incorporated into all of these different other funding and content areas. So the first that I'll highlight is the Community Health Worker Empowerment Collaborative. This is a group that started solely made up of community health workers, and still is, by the way. And those are solely CHWs who were originally funded through 2109 CCR. But now that group has started to expand to include other CHWs who are perhaps in the 2109 catchment areas, but maybe not directly funded by the CCR funding. But also has begun to expand to include other CHWs who are working within some of these other program areas or in the NOFOs, right? So CHWs who might be working under the 2320 diabetes grant join in on the Empowerment Collaborative, or CHWs who are working with physical activity nutrition. The group is expanding to include them as well. So just beyond that 2109 work. I mentioned this a little bit earlier, but also the CHW supervisor group is a space for both new and veteran community health worker supervisors to convene and discuss best practices, supervisor training needs, and the nuances of supervising community health workers in various employment settings. And then there's also been some recent momentum in Wisconsin CHWs to develop and strengthen a statewide association that could include a definition, training standards, and a CHW registry. And so, working to build up a eventual workforce coalition that collaborates with CHW allies and other statewide partners. So maybe the last piece is that the Chronic Disease Prevention Program has also started to convene a Wisconsin DHS-wide internal CHW group. So it's pulling together partners from across different program areas or divisions within the state health department who are all either working with community health workers or who have an interest in strengthening relationships with CHWs in any of those programs, such as HIV or asthma or oral health, behavioral health, maternal and child health, and of course, bringing in our friends from the Division of Medicaid Services to talk about, some of those additional financial sustainability pieces. So those are all, a couple different spaces that, again, hoping to cross-cut beyond 2109, but certainly also beyond our chronic disease prevention program as well to find areas of collaboration. Next slide, please. All right, so just, for some of your different groups and partnerships, maybe just a couple of ideas for consideration and a couple of takeaways is as you think about how to expand the CHW work beyond 2109 and areas for collaboration with chronic disease. One main piece is that community health worker work takes place in many areas and can take place across many areas across a state or local health department. And funding for CHW work can happen through a variety of CDC-funded initiatives or cooperative agreements. And 2109 is not just the only space where CHW work could be funded or leveraged. So, really, as you work with your programs, maybe look to see where else chronic disease or similar programs are located within your state or local health department or county level partners. Like I mentioned, this could include HIV, asthma programs, family health, wise woman programs with cervical and breast cancer screening, as was mentioned earlier, oral health, aging and disability resources, as well as minority health or offices of health equity, right? So CHW work can fit into any of those spaces. So maybe that's an opportunity to bridge some relationships and see where you can leverage resources. And then something that has been really helpful and what we're trying to do more, as I mentioned, is really convene groups to align CHW work across programs. And this just helps for coordination. So you're not duplicating or trying to mitigate when duplication happens and really leverage each other's resources and areas of expertise. And the one thing that I didn't include on the slide, but something that I really want to uplift is something that our chronic disease prevention program, certainly has room for improvement on, but something that's really important is including community health worker leadership in spaces when putting together those grant applications for future funding or NOFO opportunities, right? So, not just working within your unit, but perhaps getting some insight and thoughts from the community health workers that you plan to engage in these grant opportunities or cooperative agreements, especially because CHWs might have really amazing ideas for how best to implement the CDC strategies within any of these NOFOs in a way that really meets the needs of the priority populations for these grants. So I know timelines can be really tight, and again, we're certainly not perfect in that way, but we want to improve in that particular area. So that might be another opportunity for consideration to work with your CHWs across any of these funding initiatives. But that's all I have for today. And I think we'll switch over to some questions.
Yes, thank you, Morgan, on your presentation on incorporating CHWs into NOFO strategies. So we will be spending the next 10 minutes on Q&A. So if you would like to raise your hand and come off of mute, I could call up your name and you could come off of mute and ask your question, or drop your questions in the chat. But I do have 3 questions that I'm going to ask the presenters first. Because they were dropped in the chat previously. So one of the question is from Tara Rogan, and she asked, I think this is going to be for Betsy and Robert, are there additional materials available regarding reimbursement opportunities for these various programs? And for example, are all CHWs eligible for the stipend mentioned, or were they limited to the pilots? Are any payers reimbursing for these interventions? And I'll drop the question one more time in the chat for the 2 of you to read as well.
Robert, I think that question will be for you.
Yeah, and so what I was describing was a specific pilot that was utilized with CDC funding specific to exploring opportunities where CHWs could play that pivotal role with helping recruit and retain participants in these programs. And so the funding that was associated with that was specific to the funding from the CDC cooperative agreement. And I also mentioned that we are expanding that opportunity to a few other locations across the southwestern borders. 2 sites in New Mexico, 3 sites in Texas, and 2 in Arizona as well. But right now we are still in that initial pilot phase, trying to continue to evaluate and learn. But that is the extent of the potential funding for CHWs in that specific role with the incentive-based opportunity.
Yes, I just want to add that we don't have a straight line funding to cover direct services, especially those that are provided by community health workers or any other workforce. The Division of Irish Translation usually works through funding announcement opportunities. And within that, they could be some activities that include community health workers that some sort of compensation may be considered, which is the case of the program that Robert have described. We also made sure that if we include and engage community health workers in any type of processes that are related, let's say, for instance, formative research, for example, we made sure that the time that community health workers employ in participating in focus groups and some other formative research activities are also compensated.
Thank you. Tara, is there, did that answer your question? I don't know if you're still on.
I am. Thank you so much. I appreciate it. I look forward to additional funding opportunities to continue to help sustain the workforce. I appreciate your time. Thank you.
Thank you. Okay, so this question I think is going to be from Morgan. It's from Megan Walker. She asks, how do we get connected with these groups? And I'm
maybe a clarifying question, Megan, for you. When you say these groups, who do you mean?
I was actually able to get the information I needed from Jessica Kimber. I was referring to the CHW Empowerment Collaborative and the Supervisor Peer Group.
Perfect. Oh, I'm so glad. Thank you, Jessica, for putting that in the chat. Yeah, and again, these are things that have come out of our chronic disease prevention program, 2109 CCR, but these are things that could absolutely be replicable within any of these states for anybody on the line, or really tapping into, your state associations or your regional networks within your area as well. So Jessica has you covered. That's great.
Okay, so I have a question from T. Joseph, It says helping in finding more sources that correlates to these aspects for CHW work and community health workers and leadership roles. I don't know if T, if you're still on the line, you could come off of mute and ask your question.
I am, thank you. Just the idea of looking into programs, looking into what we do with CHWs, but when you're in a space of leadership and a lot of times that's volunteered information and you spend a lot of time doing that, but trying to find ways to braid funding as a leader, independent CHW in smaller organizations, and especially when you're competing still with larger organizations or organizations that have more person power to be able to work out how to get those funding in a braided situation, but also cover the people that are also working with you is really a struggle. And, you know, sometimes CDC funding is not necessarily the way or what have you for the situation, but just navigating that is a very rough process. And I'm sure just being a part of other organizations and talking with people always helps, but some more. Thank you.
Yeah, I would just maybe lift up T. Thank you for sharing that. I think that's a real concern for smaller, community-based organizations or smaller orgs that don't typically have the opportunity to apply for CDC funds directly or kind of more national funding directly. So I definitely hear that and have heard that from some community partners in Wisconsin too. So, I probably don't have the answer there per se, but just, want to highlight the importance of connecting with your local health department or maybe a county level health department to see where there might be opportunities for connection, for some of that braided funding. But I hear that too. And I don't know if others have suggestions or thoughts.
Well, I see the question here about what is the best way to receive funding for diabetes prevention program. I have been having no luck. Well, one suggestion that I may have is that the National Diabetes Prevention Program is through all the nation and U.S. territories, and we have a locator of those programs. Sometimes these programs are looking for services that are out there that can help them with the work that they are doing around type 2 diabetes prevention. So one idea that occurs to me right now, it's find those programs that are in your area and reach them to see if they are looking for a community health workers that can help, that can work with them in the work they are doing in the communities they serve. Robert, do you have any other idea?
Both of those are, those are great examples. I don't have anything additional, but yeah, working with what's available there to start with. A lot of these organizations, they're connected to their state health departments, has been mentioned before. They're a great source to, also find out where you can play a role. Sometimes they're looking at various opportunities as well.
Due to time, Tara's question is going to be the last one. So Tara has a question that she put in the chat, and it says, has anyone looked into whether the recent Medicare Part B rule permitting reimbursement for auxiliary personnel like CHWs for CHI and PIN services will provide reimbursements for these interventions?
again, I'm not the Medicare expert here, but maybe just offering some things that at least the CHW folks in Wisconsin have looked into. So Tara, thanks for bringing that up, because I know, with our the last Envision webinar had a lot around this and a lot of great information, but I think the how is really coming up for folks of how to implement kind of this new Medicare ruling to support CHW work, perhaps more sustainably. So I think this is a question that Wisconsin is having as well. And I'm sure Jessica could speak more to this, my colleague too, but something that came out of the CHW supervisor group that we've kind of convened through 2109, that includes participants, CHWs who are supervisors, kind of program director staff or admin folks who are also supervising CHWs. That group has convened a subgroup specifically to discuss kind of how the ins and outs of the Medicare ruling could be implemented. And just recently, we're looking to expand that group in Wisconsin, at least to include some partners from healthcare or the ADRCs, folks who would be serving Medicare recipients, and maybe even the Division of Medicaid Services, just for some of that insight, or kind of billing codes or policy folks. So I don't have a great example of anybody in Wisconsin who's actually gone through and done that billing, but there might be opportunity within your state to start convening some people, like local tribal health departments, like health systems, like some folks in your state health department and community health workers, to really kind of figure out how that best works in a way that maintains the integrity of community-based community health workers, and not in ensuring that it doesn't become medicalized or solely based in clinical settings. So that's just some perspective that I would bring to that, but probably not a finite answer of how it's done.
I have added 2 links on the chat. One of them, it's linked to find the national DPP program, so you can locate those programs in the community you serve. And the second one is the link to our actual funding for state health departments and others, that has 2 strategies that are linked to community health workers. So, and then all the people who have been receiving the fundings are listed in that web page. That will help you please make those connections.
Thank you so much for all your questions, and thank you to the presenters for answering the questions as well.